For years, a shadow has been cast over NHS services across Hammersmith and Fulham. Controversial plans from London health bosses and central government proposed slashing services at Charing Cross, having already closed Hammersmith A&E. Since May 2014, the new administration at H&F has been fighting these plans with the support of local residents. This is the story of their campaign.
When I heard about the plans to shut Charing Cross Hospital, I was a bit shocked because I couldn't understand why they would want to close something that is so needed by the local community.
The plans as they stand will strike a hammer blow to local health services, with Charing Cross Hospital replaced by a GP-led clinic just 13% of the size of the demolished hospital. Charing Cross A&E replaced with an urgent care clinic that will not take any blue light emergency ambulance patients. The majority of Charing Cross Hospital sites sold off to developers.
Well, when I heard that they were going to close the A&E in Charing Cross, I was shocked, quite honestly.
Personally, I think those plans are really, really awful because my mother, she got very, very sick 3 months ago, and if it wasn't for the A&E being right here, she would have sadly passed away already by now.
It's absolutely a central part of our well-being, I would say.
They really need to keep it open for people like me and other patients.
Well, I understand why people are angry. Of course they're angry. They are right to be angry. The plans to close Charing Cross Hospital, the plans for shaping a healthier future across North West London are just wrong, and they would put people's health at risk.
The Independent Healthcare Commission, established by Hammersmith and Fulham Council alongside the 4 neighbouring London boroughs, Brent, Ealing, Harrow and Hounslow, ran like a public inquiry. Commission Chair Michael Mansfield QC, alongside his 2 co-commissioners, took evidence at public hearings across North West London. Their landmark report sent shockwaves through both government and the NHS following its launch in December 2015.
So thank you to everybody who's worked on this programme. Thank you for everybody who's made this the most thorough public inquiry into the NHS cuts that have gone on to date. And I now hand you over to Michael Mansfield.
The overall thrust of what we're saying about this plan proposal, which is already being implemented in a piecemeal fashion, is stop.
As well as the risks posed to patients and the huge financial cost of the plans, commissioners warned of the dangers of vital NHS services being lost forever.
Some of you may remember the Beeching railway closures of the 1960s. It was the age of the car. Who could have forecast today's overwhelming demand for rail travel? This is not the time to be getting rid of assets. It is not the time for North West London to do a Beeching.
Moments after the report was launched, we spoke with Commission Chair Michael Mansfield and Hammersmith and Fulham leader Councillor Stephen Cowan.
I'm very familiar with Charing Cross because I've been there many, many times, and I think it's a very fine hospital. So do a lot of other people. It's a centre of excellence. I can't conceive of why anybody would want to close, sell off, destroy the site, move its basic functions elsewhere, close its A&E. I think, put boldly, it doesn't add up.
I think that the biggest issue for us in Hammersmith and Fulham is the government currently wants to close down Charing Cross Hospital. And if Charing Cross Hospital is allowed to close, people's health will be put at significantly increased risk. This report lays that out in detail. And therefore what we're calling on is all those responsible for these closures to stop and think again. And if they do that, then we will talk to them. But if they don't, then we will pursue every possible mechanism, including legal, in order to make them stop. And that's what we're doing at the moment.
And the press coverage was just as hard-hitting, making national headlines and leading news bulletins across the capital. But how did residents respond?
I support the plans by Hammersmith and Fulham Council to look at and review the circumstances as to why they want to close Charing Cross Hospital, and I would support them in any decision they make in order to go to court, because that would be what I would be doing.
I think the council are very right to fight these plans. They're definitely, they're just spot on to do that, because without the A&E being here, my brother and my mother, they were so sick and they would have to go to St Mary's, and that's just too far and they would never have survived. So those plans are absolutely spot on for them to fight that.
If we have to resort to going to court, then so be it. I think it's absolutely essential that we do that.
I think the council has done the right thing in deciding to go on fighting this closure.
Now, I cherish the NHS. The NHS has saved my life on more than one occasion, and I'm not going to see it go down because of a shoddy approach taken to people's healthcare. This council has one clear responsibility above all other responsibilities, and that is to protect the well-being of the people who live in this borough. At the heart of that is the NHS and public health. And if anybody thinks we're going to let health officials close down Charing Cross Hospital, putting people's lives at risk, then they should expect a very tough fight.